The PEDAL trial is a trial we're leading out of St Vincent's Hospital. It essentially involves patients who are concerned they have prostate cancer but not already diagnosed with prostate cancer. So this may be because of an elevated PSA, family history of prostate cancer, or an abnormally feeling prostate on digital rectal exam. So these patients in Australia, the gold standard for them is to go and have a multiparametric MRI to image the prostate and look inside the prostate for any abnormalities. The trial involves the patient having a PSMA PET at the same time as the MRI. So the PSMA PET scan is a relatively new scan that has not been examined in this setting before to see if it can help diagnose prostate cancer. So patients have both the MRI and the PSMA PET scan to detect any abnormalities inside the prostate. And if there are any abnormalities seen, they then proceed to have biopsy. So today we're going to show you a prostate biopsy. Prostate biopsy involves putting a needle into the prostate and taking a sample of tissue, which is then examined for evidence of appearance of prostate cancer. So this is the ultrasound probe, which captures the image of the prostate, and it's inserted into the rectum, which is directly behind the prostate. So what the computer is doing is capturing these ultrasound images. So we scroll from the base to the apex of the prostate. There we go. To try and better target these abnormalities seen on the pre-biopsy imaging, the method we're going to demonstrate today is called a software fusion, where we use computer software to import the MRI images into the computer before the biopsy. Huong is then able to map out the MRI images and the abnormality on the MRI. And the computer then will be able to show us on the ultrasound where to target the abnormality.
We are currently looking at the cross-sectional image of the prostate. The image on the left of the screen is a sagittal plane, which is looking at the prostate from left to right. The top right corner image is an axial plane, which is the plane that divides the body into the upper and the lower part.
Now that I've finished the target, I do a systematic biopsy, which is a sampling of the prostate, which is divided into 20 zones.
This is a three-dimensional image of the prostate that was captured on prior MRI imaging. In addition, we can also see clearly the area concern that was reported earlier on the MRI. The red contour on the screen is the prostate structure that was captured on the ultrasound on the day of the procedure. The prostate is about 35 cc, which is an average size. Before we start the biopsy, both the ultrasound and the MRI images were fused using a software fusion. The software fusion allows the previously acquired MRI to the capture ultrasound image. The fused images provide an accurate 3D location of the suspicious area of concern, allow real-time tracking of the procedure. This allowed the biopsy procedure to be done in real time with greater confidence and accuracy.
With imaging, such as the PEDAL trial, where the patient gets an MRI and even a PSMA PET prior to biopsy, we have the advantage of seeing any abnormalities inside the prostate before we do the biopsy.